third of people in England who tested positive for coronavirus at the end of May could not be contacted by the new NHS Test and Trace system. Baroness Dido Harding, the woman in charge of it, says the system is functioning, but it's not yet a gold standard service. Anyone who tests positive for COVID-19 is now asked to give details of people they've spent more than 15 minutes with, less than 2 metres apart. Those people are then contacted and told to self-isolate for a fortnight. The new system is seen as a vital tool to control local spikes in infection. The first NHS figures show that just over 8,000 people who tested positive in a week were then referred to the contact tracing system. 2/3 of them were contacted, but more than 2,500 people who had tested positive couldn't be reached. Tracers working for the new service did track down almost 32,000 people who'd been in close contact with those who had the virus. They spoke to 85% of them and told them to self-isolate. But again, a large number of names given couldn't be reached, almost 5,000. Here's our health editor, Hugh Pym.
If you test positive, NHS Test and Trace will contact you to trace people you might have infected.
Testing and tracing is vital to prevent future coronavirus outbreaks developing. A new system for England was launched 2 weeks ago. Now we have some details of how it's working. In the first week, 2/3 of those testing positive handed over details of people they'd recently been in contact with.
Save lives.
Are you a bit concerned that with 1/3 of people who tested positive, for whatever reason, you couldn't get details of recent contacts?
I think that the system has worked well, and to get 2/3 in the first week of operation, it beat my expectations, and then to have the vast majority, 85% of the contacts that were given, self-isolating, that beat my expectations too. And this system gets better and better.
Here's how contact tracing should work. If I test positive for the virus, I'd be contacted by officials by phone or email and asked who I'd met up with in recent days. And that means meetings at less than 2 metres, face to face, not someone I might have bumped into in a shop. That might include, for example, friends I'd spent time with and work colleagues I might have been in meetings with, or a wider circle of recent contacts. All that would then be assessed by a clinical team, and those people might be contacted and told to self-isolate for 14 days. Testing's carried out at drive-through centres, at locations visited by mobile teams and in hospitals and care homes. Home test kits are sent out. Then information on those testing positive is sent to health officials who find out more about the contacts. One of them is Josie. She's working from home in Redcar.
Everybody that I've spoke to has been more than happy to share the information that we need. And at the moment, I've only had people that have had a couple of contacts or, a handful. But I guess once lockdown measures ease, then maybe we will see more contacts.
Then the tracers have to follow up the contacts. Some who wish to remain anonymous have told us they've had very little work to do.
It's not right that you're paid to do nothing. I think the time could be better spent. There's mass confusion about the system and about what to do, what advice to give, and to say it's world beating is a bit of a joke.
In a similar system in Scotland, there's an average of 1.5 contacts traced for each case. Northern Ireland were the first to be launched in the UK, and Wales also have testing and tracing programmes. The authorities in England say the system works, but it's early days, and there's more to do to reach a wider public. Hugh Pym, BBC News.
Businesses across Britain are calling for the 2-metre social distancing rule to be relaxed and reduced to just 1 metre to help the economy recover and allow more schools to reopen. Downing Street says it's being kept under review. Our business editor Simon Jack looks at the difference it could make.
Morning coffee at the Black Goo Cafe in Tring, Hertfordshire comes with a complimentary and compulsory temperature check.
That's good. OK, great.
Sacha Leake started the cafe 4 years ago, and she's been surviving on takeaways, opening just 3 days a week. She would love to welcome her loyal customers back inside, but can't see it happening.
People would come in here, virtually sit on each other's laps. The whole thrill was being able to get a seat in here. We'd have like 12 staff working. All of that has to change. It's scary because we don't know, really, if we can't put people in here, we're not going to get the revenue. We're not going to survive.
Hi, Peter. Hi. Thank you. So,
100 yards away, Peter Bauld showed me the alterations he's made to one of his 28 pubs. He has 1,000 staff.
which reduces capacity, presumably?
Considerably.
Okay.
950 of them on furlough. He's convinced he is ready to reopen, but fears many others may never if the 2-metre rule isn't relaxed.
I would estimate that if 2 metres was in place, that a huge number of pubs will never, ever, ever reopen. For us, it would mean that we'd be able to open some, but it'd be sub-economic. We really need it to get nearer a metre for it to make any kind of sense.
Now, the difference between 2 metres and 1 metre may not sound like a lot, but for the hospitality industry in particular, it's huge. At 2 metres distance, the venue is operating at an estimated 30% of capacity. In other words, it's losing money. 1 metre closer, and it can operate at around 70% of capacity. You've got a chance of breaking even. That distance could be the difference between survival and going bust, and hundreds of thousands of jobs depend on it.
But what about the health implications of relaxing the 2-metre rule? Germany applies a 1.5 metre standard. In Norway and Sweden, it's just a metre. Are we risking jobs by playing it too safe? Linda Bauld is a professor of public health at Edinburgh University.
If you had 100 people in a room, in terms of the risk of infection, depending on the setting, it would be around 13 people, for example, who might be infected if you're within 1 metre. If you go beyond that, for example, to 1.5 metres, it reduces a lot to around 3 people, actually. And then if you go over 2 metres, it reduces again by 50% to just over 1 person.
The government's target date for easing restrictions on the hospitality industry is July the 4th. But relaxing the 2-metre rule will be more than the icing on the cake. Without that, there may be no cake at all. Simon Jack, BBC News.
There are more implications for businesses emerging tonight. Checks on goods coming into the UK from the EU next year could be much less rigorous than planned. It's understood that the impact of the coronavirus means the government may need to take a more flexible approach. Well, our political correspondent Chris Mason is at Westminster. What more can you tell us?
Well, Brexit might have gone quiet, but it has not gone away. You'll remember that we formally left the European Union at the end of January. We are in this transition period where technically, yes, we are outside the EU, but in pretty much all practical terms, we are still in. And we're in a transition period that runs until the end of this year. Now, the government is likely to confirm formally very soon that that transition period will not be extended. That's what they've been saying repeatedly for the last few months. But a report in the Financial Times tonight saying that they will change their approach to imports coming into the country immediately after the end of the transition period at the start of next year. They will have a more flexible, pragmatic approach. And a source confirming that tonight, saying to the BBC that that is essential given the impact of the coronavirus as businesses adjust to the reality after the virus, but also to being outside of the single market and the customs union, two of those big economic structures of the European Union. You might have thought you'd heard the last of Brexit. You haven't.
Chris Mason in Westminster, thank you.